name is Nina. I'm a student nurse. I have an order to change your dressing for your tracheostomy. I'm gonna go ahead and get my things settled at the moment. Just give me a second. Okay, and then before I get started, I'm gonna go ahead and wash my hands, provide privacy, and I need to do a check on your full name and date of birth. If you could please state that.
Yeah, absolutely. It's Trevor Neil Kracher, and the date of birth is June 7th, 1988.
Wonderful. Okay, Mr. Kracher, so I'm going to turn up your oxygen level here, and we're gonna make sure you are oxygenating at 100%.
Okay.
We'll keep that pulse ox on you here. And I'll go ahead and get my equipment ready. Make sure your vitals are all stable. Okay, and then I'll go ahead and set up. Do you have any questions? Do you need to use the restroom right now?
No, I'm good. Thank you, though.
Okay. I would open this up here. Open up my bandage here. Just get my things ready. Okay. Toss that. And then my normal saline. I'll make sure it's a brand new bottle. I'll put my name or initial date and time. Make sure this is only available or used for 24 hours, no more than that. Okay. Zip the box. I'll be needing this. I'm gonna go ahead and get my sterile gloves. Make sure that I'm only touching within the 1-inch border. And then I will open my Q-tips. So this will be considered contaminated if it's touching the 1-inch border, so I will not be using that. I would call for the aide to bring me more Q-tips. Now I will be putting on my gloves. Okay. Now I will be opening this, putting water into that box, closing it up, and I will be moving my sterile Q-tips here. This will be, pretend this is sterile. Okay. And I'll be putting on my second glove. Okay. Now I will be placing these Q-tips in here. Okay. All right, Mr. Kracher, so I see you're Oxygen saturation is at 100%. We can go ahead and proceed. I'm gonna go ahead and take off your oxygen, okay?
Okay, great. Thank you.
Okay. So this will be my clean hand, and this will be my sterile hand. I will be replacing, taking this off with my dirty hand here, and then replacing it with a new tube, making sure it clicks and stays in place. Okay, and then checking the oxygen saturation. We are still good, above 90. Now I'm gonna go ahead and remove this dressing here. Gently, okay, putting in the trash, okay. Now I'm gonna go ahead and take a Q-tip and clean underneath the stoma, okay. I'm gonna go ahead and go underneath the stoma again. And I'm gonna go above the stoma. Go above the stoma again. Okay. All right, now I will be placing the new dressing. Okay. Okay, now I will be replacing the straps. First, I will go ahead and connect this side. Okay. And I'm gonna go ahead and lift your head up, Mr. Preacher. Okay. And place it on the other side. Okay. Make sure it is there's a you can fit 2 fingers in the straps here. Not too tight, not too loose. 2 fingers, it's good. And I'm gonna go ahead and remove the old straps. Check, make sure Mr. Crater is still oxygen saturation is above 90, and it's good still. Okay. Go ahead, dispose of this. Okay, here's your oxygen. How are you doing, Mr. Crater? Are you doing okay?
Oh yeah, great.
Take a big deep breath, and I'll go ahead and clean up here. Make sure everything is in the biohazard. Okay. Take off my gloves. Okay. Put that in the trash. I'm gonna go ahead and lower your bed. And then here's your call light. Do you have any questions before I go?
No, everything's fine. Thank you so much.
Okay, and your oxygen is still very good, over 90%. Awesome. I'm gonna go ahead and wash my hands, undo the privacy, and then I'm gonna go document. Okay, thank you.